Good morning, and thank you for being here. Today, I want to share practical, low-risk ways to ease pain in older adults and to do so in a way that respects the realities of aging, multiple medications, changing balance, different goals, and the desire to stay independent. I'll start with gentle options you can try early, move through food choices that can help or hurt, and finish with the most powerful tool we have: safe, simple movement. Please remember, this is general information. The right plan always comes from a conversation with your own clinician. When pain flares, it's reasonable to begin with treatments that act locally. For osteoarthritis in the knees and hands, topical anti-inflammatory gels can reduce pain with far fewer whole-body side effects than pills. Many people also find heat wraps soothing for short-term low back pain, while a cooling gel can take the edge off after activity. A thin layer of capsaicin cream on the knee may help when used consistently, and higher-strength capsaicin patches or lidocaine patches can be considered for certain kinds of nerve-related pain, such as after shingles, when used correctly and under guidance. These approaches won't cure arthritis, but they may create enough relief to let you walk a bit farther, sleep a bit better, and do the exercises that truly change the course. If pain persists, some oral medicines can help, but the risks and benefits look different in older adults. Acetaminophen can be useful for short periods, provided we respect the total daily dose and liver health. Anti-inflammatory pills can work well, but can also irritate the stomach, stress the kidneys, and raise blood pressure, so we use the lowest effective dose for the shortest time, if at all, and we avoid combining them with other drugs that increase bleeding. Medicines that act on the nervous system, like duloxetine, can help some people with knee osteoarthritis or chronic low back pain, but they require slow starts and careful monitoring for dizziness or sleep changes. Strong pain pills such as opioids are rarely a long-term solution in older adults. They increase the risk of falls, constipation, and confusion. If they are used, it should be in very select situations with tight follow-up and a plan to step back down. Non-drug therapies deserve a central place. Massage, acupuncture, and spinal manipulation each have modest evidence for certain conditions and can be reasonable adjuncts when provided by qualified practitioners. Just as important are the simple comforts at home: warm showers to loosen up in the morning, a supportive chair that lets you stand without strain, walking poles that share some load with the upper body, and well-fitting shoes that improve stability and confidence. Food is another lever we can pull. There is no magic ingredient, but patterns matter. A Mediterranean-style way of eating, vegetables and fruits at most meals, beans and lentils often, whole grains, nuts, olive oil, and fish once or twice a week, aligns with better weight, better energy, and less inflammatory burden. For painful joints, even modest weight loss can translate into meaningful relief, especially in the knees and hips, which bear our load with every step. Think first about what to add. Extra vegetables on the plate, a handful of unsalted nuts for a snack, a drizzle of olive oil on salad, and water or tea between meals. Aim for adequate protein, usually a palm-sized portion at meals, to maintain muscle. Then consider what to trim: ultra-processed foods high in added sugar and refined starch, and excess alcohol, which can worsen sleep, weight, and pain perception. Some supplements are frequently asked about. Omega-3 fats from fish or capsules can modestly improve symptoms for some people. I prefer starting with food: salmon, sardines, trout, and discussing capsules only after reviewing medications that affect bleeding. Turmeric or its active component, curcumin, can provide small improvements in knee pain for some. The products vary widely, and it's important to check for interactions with blood thinners or gallbladder issues. On the other hand, glucosamine and chondroitin are generally not recommended for knee or hip osteoarthritis. The overall evidence is not convincing there. Whatever you choose, think of supplements as an adjunct to, not a replacement for, movement, weight management, and proven therapies. That brings us to the intervention with the biggest return: moving your body most days of the week. For older adults, a simple, safe plan combines 3 ingredients. First, aim for about 150 to 300 minutes per week of moderate-intensity aerobic activity. Brisk walking that lets you talk but not sing, water walking or swimming if your joints prefer it, gentle dancing, or time on a stationary bike. Spread it out however you like. 10 minutes after breakfast, a few minutes after lunch, and a longer stroll in the evening works beautifully. Second, add muscle strengthening on 2 or more days per week. You don't need a gym. Sit-to-stands from a chair, wall push-ups, step-ups on a low stair, resistance band rows, and calf raises while holding the countertop can build the legs, hips, back, and arms that protect painful joints. Third, include balance practice at least 3 days a week to reduce fall risk. Try standing with one foot directly in front of the other while holding the counter, shifting weight from side to side. Walking heel to toe down the hallway, or joining a Tai Chi class which combines slow strength balance and calm attention. If you live with knee or hip arthritis, prioritize strengthening the quadriceps and hip muscles, and choose low-impact cardio like walking on flatter surfaces, cycling, or pool work. A cane in the opposite hand from the painful side can offload the joint. Certain braces can help patellofemoral or tibiofemoral pain. If you live with long-standing low back pain, keep moving. Walking, gentle core exercises, yoga or Tai Chi, and short-term heat during flares are reasonable. For neuropathic pain, especially after shingles, carefully used topical therapies may be part of a broader plan that also addresses sleep, mood, and gentle conditioning. Safety and personalization are the heart of success. Use the talk test or a 0 to 10 effort scale, and start around a 3 or 4. Increase no more than about 10% per week. Check footwear and the walking environment, keep a hand on a stable surface for balance drills, and pause to measure blood pressure if you're adjusting medicines. If pain spikes and stays higher for more than a day after an activity, that's feedback to dial back the dose, not a failure. Celebrate small gains. 1 more minute on the bike, 1 more sit to stand, 1 steadier step while brushing your teeth. In the end, easing pain in older adults is less about chasing a miracle and more about stacking small proven wins. Start with topical and non-drug options. Use food quality, protein, and hydration to support tissues and weight. Move most days with a blend of cardio, strength, and balance, because strong legs and steady feet are pain's quiet antidotes. Work with your clinician to tailor the plan around your medications and conditions, and keep notes on what helps. With consistency and support, comfort grows, function returns, and independence expands. Thank you.